If you are over 60 and still waking up drenched, rushing to the bathroom, or seeing even a trace of blood, please do not tell yourself, it is just menopause. Sometimes the symptom that feels familiar is the one that deserves a second look. I'm Dr. Claire Bennett, and today I want to walk you through 7 menopause symptoms women over 60 still should not ignore. Not because every symptom means something dangerous, but because this is the age when guessing can quietly become a mistake. Before we go into the list, let me say something that often helps women breathe a little easier. Menopause symptoms do not always end neatly at 50 or 52. Some symptoms can continue for years, and some women still deal with hot flashes, sleep changes, vaginal dryness, urinary problems, mood shifts, and body aches well into later life. That said, not every symptom in your 60s should automatically be blamed on menopause, because some changes may reflect aging or another health issue that deserves its own assessment. That is the balance we need. Not panic, not dismissal, just thoughtful attention. One more thing before the list. Menopause is a stage, not a diagnosis that explains everything forever. And once a woman is over 60, symptoms need a little more context. Because by then, menopause can still be part of the picture, but so can thyroid disease, sleep apnea, diabetes, medication side effects, arthritis, bladder conditions, depression, pelvic disorders, and ordinary wear in the body that has nothing to do with estrogen. That is why a symptom can be common and still deserve attention. Let's start with the symptom I never want an older woman to brush aside. Number 1, any vaginal bleeding after menopause. This is the big one. If you have gone a full year without periods, and then you notice bleeding, spotting, pink discharge, brown staining, or blood after sex, that needs medical attention. Even one episode matters. A lot of women delay because the amount is tiny. They say, it was only on the tissue, or it was just once, or maybe I strained, or I thought it was from dryness. Please do not make that decision on your own. Now, I want to be calm and honest here. Postmenopausal bleeding is not always cancer. There are several non-cancerous causes. The vaginal tissues can become thin and fragile after menopause because of lower estrogen. Polyps can bleed. Hormone therapy can sometimes cause unexpected bleeding. Sometimes the bleeding is coming from another nearby source, and not the uterus at all. But this is still one of those symptoms that has to be checked, because bleeding after menopause can also be a warning sign of precancer or cancer of the uterine lining, and the whole point is to catch that early when it is more treatable. This is what many women over 60 tell me. I thought it was hemorrhoids. I thought it was a little tear. I thought it was dryness because intercourse felt uncomfortable too. I waited because it stopped. That stopping can be misleading. A symptom does not have to be constant to be important. What should you do? If you see blood after menopause, book an appointment promptly. Be ready to describe when it happened, how much there was, whether it followed sex, whether you are using hormone therapy, and whether you have pelvic pain, pressure, or unusual discharge. Do not be embarrassed by small amounts. Small does not mean unimportant. And if the bleeding is heavy, you feel faint, or you are soaking pads, that is more urgent. Number 2, hot flashes or night sweats that continue, return, or suddenly get worse. And I want to say this in a very respectful way. Too many women have been taught to laugh these symptoms off. They joke about carrying a fan. They joke about sleeping on a towel. They joke about changing the sheets in the middle of the night. Sometimes humor helps, but humor can also hide how disruptive the symptom really is. A lot of women are surprised by this one because they think hot flashes belong only to the early menopause years. But some women still have them in their 60s, and even later. In fact, one reason older women sometimes stay quiet about them is because they feel they are too old to still be having menopause symptoms. You are not too old. But here is where I want you to pay attention. If you are having the same mild hot flashes you have had for years, that is one situation. If you are suddenly having drenching night sweats, intense flushing, poor sleep, or a major increase in symptoms after a long quiet period, that deserves a better look, because while hot flashes can certainly persist, sweating and flushing are not exclusive to menopause. They can also be confused with medication side effects, thyroid problems, infection, low blood sugar, anxiety episodes, alcohol triggers, or other medical issues. This matters especially over 60 because the body is often carrying more than one story at the same time. A woman may think she is just hormonal when she is also reacting to a medication change, or she may think she is just warm at night when poor sleep, alcohol, a heated bedroom, or untreated sleep apnea is making the symptom much worse. What do hot flashes usually feel like? Most women describe a sudden wave of heat rising into the chest, neck, and face. The skin may flush, sweating can follow. Then sometimes there is a chill afterward. At night, it may mean waking with damp clothing or wet sheets. When should you pay closer attention? If they are destroying your sleep, if they are new after years of calm, if they come with weight loss, fever, chest discomfort, or a big change in your general health, or if they are affecting your mood, memory, and energy because you are no longer resting properly. The practical next step is simple. Do not suffer in silence and do not self-diagnose too quickly. Track when they happen. Note alcohol, caffeine, spicy food, stress, bedtime temperature, and medication timing. That pattern often helps. And if they are frequent or intense, bring that record to your clinician. Treatment options may include lifestyle adjustments, non-hormonal approaches, or hormone therapy in selected patients, depending on your health history and how far you are from menopause. Number 3, sleep problems that are becoming your new normal. If you ask me which symptom quietly drains the most quality of life in older women, sleep is very near the top of the list. Women will tell me, I can function on 5 hours, or it's just aging, or everyone my age sleeps badly. No. Sleep changes are common with menopause and aging, but poor sleep should never be waved away simply because you are older. Sometimes the problem begins with night sweats. Sometimes it is anxiety, low mood, pain, bladder urgency, restless legs, medication timing, or sleep apnea. And sometimes the woman no longer knows what came first. She only knows that she feels worn down. This is how it often sounds in real life. I fall asleep, but I wake at 2 or 3 in the morning. I'm exhausted, but my body won't stay asleep. I wake up hot, then cold, then I need to pee. By afternoon, I feel shaky and irritable. I forget words, and I wonder if something is wrong with my brain. Chronic poor sleep can blur into everything else. It can worsen concentration. It can deepen anxiety. It can make pain feel worse. It can increase irritability and make hot flashes feel more unbearable. So when I say do not ignore sleep problems, I do not mean one rough night. I mean a pattern that is stealing your daytime function, mood, memory, steadiness, and confidence. A very important point here is that insomnia is not always from menopause anymore, just because menopause started the story. At 60 and beyond, you also have to think about breathing problems during sleep, depression, medication effects, chronic pain, nighttime reflux, bladder conditions, and sleep disorders that need their own treatment. That is why I want women to stop settling for, I guess this is just life now. Your sleep is a health issue. A practical first step is to look for the pattern. Are you waking soaked in sweat? Are you waking with worry? Are you waking to urinate several times? Do you snore loudly? Do you gasp awake? Are you taking decongestants, steroids, or late-day caffeine? Do you nap for long stretches and then cannot sleep at night? Write it down for 1 week. That 1 week of detail can be more useful than a vague memory during an appointment. And if sleep loss is making you depressed, foggy, unsteady, or unsafe to drive, please get help sooner rather than later. Number 4, vaginal dryness, burning, irritation, or pain with intimacy. This is one of the quietest symptoms on the list. Not because it is rare, because many women do not bring it up. They feel embarrassed. They assume sex is not important anymore, or they think discomfort is just part of getting older. It is common, yes, but common is not the same as something you must simply live with. After menopause, lower estrogen can make the vaginal and vulvar tissues thinner, drier, and less elastic. That can lead to dryness, burning, itching, irritation, or pain with intercourse. Some women also describe a raw feeling, stinging when they sit for too long, or discomfort even without sex. And here's the part I especially want older women to hear. If intercourse becomes painful, do not just stop the conversation and suffer quietly. Painful sex can affect closeness, confidence, sleep, mood, and the relationship you have with your own body. It can also be confused with other problems: yeast infections, skin conditions, pelvic floor tension, vulvar disorders, or in some cases, lesions that need proper examination. Women often say, I thought I kept getting infections. I burn, but my tests come back normal. I just use more lubricant and tolerate it. I avoid intimacy because I'm afraid it will hurt. Those are clues, not complaints to minimize. This group of symptoms is often part of what clinicians call genitourinary syndrome of menopause. And unlike some hot flashes that fade with time, these symptoms often continue and may get worse without treatment. That is why ignoring them for 5 years usually does not make them disappear. It just makes women adapt around them. What should you do? Bring it up directly. And please do not wait until the problem is severe enough that you are avoiding every exam, every holiday, and every form of closeness. The earlier these symptoms are addressed, the easier it often is to break the cycle of pain, tension, avoidance, and fear. You do not need fancy words. You can simply say, I have dryness, burning, or pain, or sex has become uncomfortable, or I feel irritated down there even when I do nothing. There are treatment options. Some women do well with moisturizers or lubricants. Some need local vaginal estrogen or other prescription treatment, depending on their health history. The important thing is that you get assessed instead of silently working around the problem. And if you notice sores, bleeding from the area, marked tenderness, or pain that is clearly getting worse, do not assume dryness is the only cause. Number 5, urinary urgency, burning, leakage, or repeated urinary tract infections. This is the symptom group that steals freedom. It changes road trips, it changes exercise, it changes sleep, it changes whether a woman feels comfortable going to church, shopping, meeting friends, or sitting through a long appointment without scanning for the nearest washroom. This symptom group causes a lot of confusion because women often split it into separate problems. One woman says, my bladder is weak. Another says, I keep getting UTIs. Another says, I don't leak, I just have to run. Another says, it burns, but they tell me it's not an infection. Sometimes these are connected. As estrogen drops after menopause, the tissues around the bladder, urethra, and vagina can change. That can contribute to urgency, frequency, burning, leakage, discomfort, and a higher risk of recurrent urinary tract infections. So yes, bladder changes can absolutely be part of menopause. But again, that does not mean every bladder symptom should be labeled menopause and ignored. This is especially important over 60 because urinary symptoms can also reflect infection, pelvic organ prolapse, overactive bladder, medication effects, irritation from products, incomplete bladder emptying, diabetes, or sometimes a problem that needs a different kind of evaluation. A woman may say, I have to know where every bathroom is. I get up 3 or 4 times a night. I leak on the way to the toilet. I keep being treated for infections. My urine tests are not always positive, but the burning is real. All of that deserves a proper conversation. Repeated antibiotics without a clear picture are not the whole answer. Neither is wearing pads and saying, well, this is what happens at my age. Please do not normalize distress simply because it is common. When should you seek help? If you are getting repeated UTIs, if urgency or leakage is affecting daily life, if you are waking many times at night to urinate, if you have burning, blood in the urine, fever, back pain, or new incontinence, if bladder symptoms are interfering with sleep, walking, travel, or exercise. A very practical step is to note what is actually happening. How often are you urinating? Is it burning? Are you leaking with cough and laugh? Or is it an urgent rush? Are symptoms worse after certain drinks? Are urine cultures actually positive? Do symptoms improve with vaginal treatment or only with antibiotics? That detail helps separate one problem from another, and for many postmenopausal women, treating the underlying tissue changes can make a real difference. Number 6, low mood, anxiety, or brain fog that changes how you live. I want to speak gently here because many women over 60 have spent a lifetime pushing through. They say, I'm being silly, I'm just emotional, I should be able to cope, maybe I'm just getting older. Maybe this is the beginning of dementia. Let me slow that down. Mood changes, anxiety, trouble concentrating, forgetfulness, and feeling unlike yourself can happen around menopause. Poor sleep can worsen them. Hot flashes can worsen them. Chronic stress can worsen them. And later in life, grief, caregiving strain, loneliness, retirement changes, chronic illness, and pain can all pile on top. So yes, menopause may be part of the picture. But if your mood has truly changed, or your thinking feels less steady than before, do not reduce that to a personality flaw. And also do not assume it is just hormones. That middle ground matters. Here's what I listen for. Does she still enjoy anything? Is she more withdrawn? Is she tearful for reasons she cannot explain? Is she constantly on edge? Is she losing confidence because she cannot find words? Is she forgetting appointments because she sleeps badly and feels overwhelmed? Or is something more serious happening, such as major depression, medication effects, thyroid disease, vitamin deficiency, or early cognitive decline? Menopause brain fog is usually described as inefficient thinking, not a complete collapse of memory. Women often say it feels like slower recall, trouble focusing, losing a word, or walking into a room and forgetting why. That can be miserable. But if confusion is worsening rapidly, if functioning is clearly slipping, or if family members are worried, that needs medical attention. The same goes for mood. Please do not wait until you are barely coping. If you feel persistently low, fearful, flat, panicky, or unlike yourself, ask for help. Especially if you stop sleeping, stop eating well, withdraw from people, or lose interest in daily life. And if you ever feel hopeless or unsafe, that is urgent. A good next step is to describe changes in plain language. I am not myself. My patience is gone. My concentration is worse. I feel overwhelmed all the time. I am waking anxious. I'm scared my memory is slipping. That kind of description is very helpful. Number 7, joint pain, muscle aching, or stiffness that you keep blaming on age. A lot of women become very stoic about pain by this age. They keep moving. They keep caring for others. They keep doing what needs to be done. And because of that, they sometimes do not realize how much function they have lost until the losses become obvious. This one surprises many women. Joint and muscle pain are recognized menopause-related symptoms, but because arthritis also becomes more common with age, many women assume all aches after 60 are just wear and tear. Sometimes that is partly true, but not always. What I do not want is for you to shrug off a real change without noticing the pattern. Did the stiffness start around the same time as other menopause symptoms? Is it worse after bad sleep? Does it feel diffuse, almost like your body is less resilient than before? Or is it sharply focused in one joint, swollen, hot, or limiting how you walk? Those questions matter. Some women describe this stage as, I feel like I aged 10 years in my knees overnight. My shoulders and hips ache when I get out of bed. I thought it was normal aging, but I'm moving less and less. Everything hurts more when I sleep badly. Menopause can overlap with arthritis, low activity, loss of muscle mass, poor sleep, vitamin issues, medication side effects, and inflammatory conditions. So when pain is persistent or escalating, the right question is not, is this menopause or not? The right question is, what is contributing and what can be treated? Because untreated pain changes life. It reduces movement, that weakens muscles, that affects balance, that raises fall risk. And for older adults, that chain can become more serious than people expect. When should you stop ignoring it? If pain is new and persistent, if a joint is swollen, red, or hot, if you are losing strength, if walking, climbing stairs, dressing, or sleeping is getting harder, if morning stiffness lasts a long time, or if you are taking more and more pain medication just to get through ordinary days. Please do not decide that suffering is simply proof of aging. Get it assessed. Sometimes the answer is improving sleep, strength work, weight-bearing movement, and symptom treatment. Sometimes the answer is arthritis care. Sometimes it is something else entirely. And that is exactly why it should not be ignored. Here is a simple way to think about it. A menopause symptom may still be a menopause symptom after 60, but a symptom deserves more attention when it does one of 5 things. It starts after a long quiet period. It becomes stronger or more frequent. It begins to interfere with sleep, walking, intimacy, travel, or confidence. It comes with bleeding, fever, weight loss, fainting, chest symptoms, or a noticeable decline in function. Or it keeps getting treated over and over without a clear explanation. That is the moment to stop guessing. And I also want to give you one small piece of practical advice that can make appointments much more useful. Do not just say, I don't feel right. Instead, give one clear example from ordinary life. Say, I wake up 3 times a night drenched. Say, I had spotting after 14 years with no period. Say, I avoid leaving the house because I might leak. Say, I used to read for an hour, and now I cannot focus for 10 minutes. Say, my hips hurt so much in the morning that I hold the wall. Specific examples help a clinician see impact, not just symptom labels. So let's pull all of this together. The message today is not that every symptom after 60 is dangerous. The message is that older women are too often taught to disappear inside their symptoms, to call bleeding a little spotting, to call exhaustion normal, to call painful sex not important anymore, to call bladder problems just old age, to call anxiety and brain fog me being difficult, to call pain the price of getting older. No, your body still deserves attention, your comfort still matters, your symptoms still count, and menopause should never become a blanket label that hides a different problem. If I could leave you with one practical rule, it would be this: pay attention to change. A symptom that is new, worsening, disruptive, bleeding-related, sleep-destroying, painful, or changing your day-to-day function deserves a conversation. You do not have to walk into a clinic with a diagnosis. You just need to walk in with honesty. Say what changed. Say how long it has been happening. Say what it is stopping you from doing. That is enough to begin. And if you are watching this for yourself, I hope you feel less alone and more confident about what deserves attention. If you are watching for your mother, your partner, your sister, or a woman you care about, please remember this. Many older women minimize symptoms because they do not want to be a burden. Sometimes the most helpful thing you can say is, "You do not have to put up with that. Let's get it checked." I'm Dr. Claire Bennett. Take good care of yourself, and I'll see you in the next video.